Okay, so now we're going to start the injection with Heather with Restylane under her eye area. She has been numbing with some numbing cream under the eye very comfortably for the last 30 to 40 minutes. So she should be very comfortable during today's experience. I'm going to simply mark the area of treatment. This is the area that we want to focus the most on for her correction and give her a nice overall lift and improvement of her lower eyelid area. You'll see everybody's eyes are a little bit different. Some eyes you have to go a little further out. I like to examine them in different angles to make sure we're approaching her in a full correction manner. We have some ice. Okay, Heather, what I want you to do is put your head back towards the wall and just get comfortable. And you can close your eyes. And we're going to start our first correction on her right eye. And I'm very simply going to place a little bit of the filler into the corner of her eye so we can lift the depression starting from the corner of her eye. I'm going to have you use some ice. One of the keys to the success of tear trough and under eyelid correction is to make sure that you're patient, to make sure that you use some ice, to make sure that the client is also sitting upright so they're not lying on a table, because the correction is actually not going to be a full correction when they lie down. Okay, and you can again clear the area. Once again, we're going to add a little bit of volume under the eye. In a very slow manner. Are you comfortable? Mm-hmm. Okay, are you feeling anything?
Not at all.
Any pain whatsoever?
None whatsoever.
Heather was very nervous actually thinking about having this treatment done, and I wanted to assure her that having it under the eye, just because it is a delicate area, doesn't mean that it's painful. We've numbed her very adequately. The fillers also these days come with numbing medicine inside it. We've added about maybe 1/4 to 2/3 of a syringe of filler, and you can already see the improvement that we're getting in the under eyelid area. Put your head back a little bit and you can see the depression is starting to get more filled in. Okay, relax back here. Let's use a little bit of ice, Heather, on the area so that you can be comfortable and we can minimize swelling. We could minimize potential for bruising, which is not uncommon in this area. This is something that I consider to be more of an advanced technique. People that have more experience with fillers will be very used to and accommodating this service, and people that have very little to no experience might be a little hesitant. So I do think of it as an advanced technique. Okay, we can put your head back. But at Nouveau, we do a lot of these corrections with myself, with our board certified plastic surgeons. This is considered a very, very common non-surgical approach to rejuvenating the under eyelid. So still very comfortable?
Mm-hmm.
Okay. How long has this bothered you?
Many years, maybe 10.
Okay. If you knew it was going to be this easy to get it corrected, would you have done it sooner?
Yes.
Okay.
I don't really feel anything.
Let's put some ice up there again. You just have to take your time and do the area. Usually we start at the corner and go around the eyelid, making the full correction We've only done about a half a cc, which is half of a syringe of Restylane at this time. Okay, and we'll get started. And I'm going to have you put your head up just a little bit, okay, and then back towards, there we go. Okay, now we're going to go start to look at her in multiple angles so that we can get a full correction. You can see the filler actually going in on that shot right there. It's a very nice correction, even out towards her crow's feet. Some people that have filler will actually say that they feel that their crow's feet has improved. It would not be an initial indication for crow's feet, but certainly something that might help to take you to the next level with your result. I'm going to put a little bit more in here. It's actually taking very little volume to get Heather a nice correction today. Okay. Typically though, on most clients, it could take 1 full syringe per side to get the correction that they want. The good news is, and this is a big one, corrections often last 1.5 years or longer, sometimes up to 2 years, with a client often coming back at 1.5 years for just a touch-up. Okay, I'm going to sit you all the way up and have you open your eyes and look straight ahead. We can tell from her non-treated eye, depression and lack of depression now on her treated eye. She has minimal swelling. She actually has no bruising, which is very nice at this time, and we're overall getting a very nice result. Okay, relax. You put your head towards the back again. And we're going to do what I call a mid-plane injection. Again, advanced technique, something that is usually done only with experienced providers so that we can continue to fill in that hollow area to her satisfaction. Okay, now what you're going to do is look straight ahead for me. And look straight ahead. I'd like them to often look up and down so that I can see every angle of correction that might be necessary. Just stay looking up for me. We're just going to put a minute amount in the side where often fine lines and wrinkles come into play. Okay, looking at you from here. I also like to look at them from an angle there. Okay, I see a little bit of flatness right here on Heather. Heather is a nice fit female, and they often tend to lack volume in their face. So volume restoration is a very common thing to give them a more youthful look. Okay, we're going to apply the ice again. And again, a very patient process. Are you feeling okay?
Yeah, I haven't felt a thing.
Is it easier than you thought it would be?
Way easier, yes. Very nice.
Okay. All right, so we're almost done this eye for this time. You'll see the eye can have a little bit of a wavy appearance. That's very normal. These are things that are going to subside, and we'll be able to show you her final results in a few days. But a wavy appearance is something we know is a histamine reaction just sheerly by putting a needle in. So that improves. It's a very, very transient part of getting your under eyelids done. Okay, so I think this eyelid is actually done for now. It took less volume than I thought. She's actually going to see overall improvements in the next couple days, with full results being seen usually in about 10 to 14 days.